Hi guys, I decided to do my science communication project on the topic of Down syndrome just because it is a very well-known genetic disorder, but not a lot of people know the causes or how to diagnose someone with it or whether it runs in the family or not. So you may ask, what is Down syndrome? Down syndrome is a condition in which a person will have an extra chromosome. Down syndrome is a genetic disorder, so typically a baby is born with the 46 chromosomes, but babies with Down syndrome are actually born with an extra copy of chromosome 21. The extra copy can change the baby's body as well as their brain development. And in 1866, John Langdon identified Down syndrome and its features as distinct entity. In 1959, Jerome actually identified Down syndrome as a chromosome condition. And then some physical and facial characteristics of a person with Down syndrome are a flattened face, specifically a bridge nose, almond-shaped eyes that can tend to slant up, a short neck, small hands, small feet, small ears, a tongue that can tend to stick out, Palmer's crease, which is known as one single crease that goes across the palm, and then a second crease that curves down by the thumb, rather than our normal 3 creases on our palm of our hand. Poor muscle tone, as well as loose joints, and then tiny white spots around the iris, which is the color part of our eye, and then this is actually known as brush-field spots. So some complications of someone that may have Down syndrome are heart defects, the GI defects, as well as immune disorder, just because their immune system is going to be higher at risk, so they have a higher chance of developing autoimmune disorders. Sleep apnea, as well as spinal problems, because some people with Down syndrome may be born with like a misalignment on the top of the 2 vertebrae in the neck that can put them at a risk of serious injury to their spinal cord, ear infections, as well as hearing and vision problems. So there are actually 3 types of variations of Down syndrome. The first one is going to be trisomy 21. This one is actually the most common one. This one will account for 95% of the cases. And this one is caused by an error in cell division called non-disjunction. The result in the embryo with 3 copies in chromosome 21 instead of the usual 2. The error in cell division can actually happen either before or at conception, where the pair of chromosome 21 fails to separate. The baby is then born with an extra copy of chromosome 21 in every cell. Translocation is the second variation of Down syndrome, and this one accounts for 4% of the cases. The total amount of chromosome in the cell will actually still remain 46. However, an additional 4 or a piece of that chromosome 21 that could have been broken off will attach to another chromosome. Typically, that other chromosome is chromosome 14. The third type is mosaicism, which accounts for 1% of the cases. So this one is actually very rare, and it occurs when a baby is born with an extra in some but not all of his or her cells. And then this one will actually have less obvious physical characteristics. And then here, as you can see, this is an actual visual form of the trisomy 21, and then this is a visual form of this last third one. The causes are actually unknown. Maternal age is kind of the only factor that has been linked to it. 80% of the children with Down syndrome are actually born to women that are younger than 35 years old, just because younger women tend to have far more kids than older women. However, a woman's risk of conceiving a child with Down syndrome actually increases after 35, since their eggs have a greater risk of improper chromosome division. And then being carriers of genetic translocation can actually be one of the linked factors, and they can pass it on to the children. Here I put a chart of like their maternal age and the risk of the woman having a child with Down syndrome. So as you can see, the older they get, the higher their chances are of conceiving a child with Down syndrome. So how is Down syndrome diagnosed? Down syndrome is actually diagnosed in two forms, prenatally or at birth. Prenatally, there is two tests, screening tests, which estimates the chances of the fetus having Down syndrome. And this will involve blood tests that measures the quantity of various different substances in the mother's blood, as well as they will take account for the mother's age. The diagnostic test, this one actually gives a definitive diagnosis. This is usually performed in the second trimester, and this test involves chronic sampling as well as amniocentesis sampling, which will give 100% accuracy. At birth, usually it is identified by the presence of certain physical traits. A chromosome analysis called karyotype is done to confirm the diagnosis. The test karyotype is done by a doctor that draws blood from the baby and will examine the baby's cells. And then this is my works cited. Thank you guys for listening.